everyone. Great to be here. Thanks for getting up relatively early to be here. And we're calling this discussion this morning, as you can see from the title up here, Beyond Anecdotes, because of the maddening and frankly pretty insulting insistence of the industry and often many decision makers that the health impacts that people are experiencing around shale gas and oil development are few and isolated. But the communities and the individuals living with these impacts, many in rural and residential areas where industrial development didn't exist before, know that that is simply not true. They are not few and isolated. And the people themselves who are impacted, including many of you here, really have the knowledge and the ability to prove that. And that's why we're here today, to talk about some of the ways to make that happen and some of the things we've been doing to bring that out. Because it's really, while we need a lot more science, it's not just a job for scientists, it's a job for all of us to counter that argument. So I always think it's good to start the morning with a picture of the planet and remind us all where we are. So to provide a little background for this, the environment that many of us live with, as we all know, and those of us who are old enough to go back to the 60s and 70s when the environmental movement really took off, know that the planet, obviously, is really stressed already. And drilling and the shale gas and oil boom is adding to that exponentially. And as I said earlier, just a minute ago, for many people it's the first time they've had to deal with industrial pollution. But all of us are impacted in many ways, and many people have what the industry likes to call pre-existing conditions or pre-existing levels of contamination in their air and water. And while drilling is really exacerbating that, and that's not an excuse for there being health impacts, it also is important to remember that because it makes it harder and more challenging to really discern exactly what the connections are. And that then also makes it more possible for industry to hide from what they're doing. So the shale boom is bringing risks and impacts and the realities of drilling closer to home for many more people. I know that some folks in the West were actually thought, finally the East is going to wake up to the impacts of energy development when Marcellus shale boom started. And so that has really been important for building awareness and bringing us all together. And that's really the important aspect of it. But of course, as we all know and we all share, and no one would wish on anyone else, it also means that the impacts will become more widespread. The loopholes in federal and state law, which is really key to earthworks work and the work of many people here, means that a lot of pollution just simply goes unaccounted for, and there's a complete lack of accountability, and the costs get shifted onto the communities and the individuals. The other aspect that is just now really emerging in force, just beginning, is serious research on health and related issues like the different pathways of exposure and fluid migration and so on. And Wilma was a pioneer a long time ago. Earthworks did work on this some years ago. But we're really just now starting to see the first large-scale academic studies on health impacts from oil and gas development. And in connection with that, agencies are starting to react. Had some pretty good recommendations from the Department of Energy last year, the EPA hydraulic fracturing study, the CDC and ATSDR, Agency for Toxic Substances Disease Registry, are starting to look into this, though somewhat under the radar. So that's all a good thing. But the result of all of this just starting up now, or in the last couple of years, is that there's a huge mismatch in timing. You know how in relationships you say timing is everything? Well, we've got a real problem here because shale gas is booming. Shale gas and oil development is booming. It's moving forward. It's started decades ago, but is really taking off now. But we don't have the measures in place to protect people and health, let alone prevent the problem. So we're going to talk today also about what the role of testing and documentation of the problems is and how important that is. Because when you don't have testing and documentation, it's very easy for the industry to say the problems simply don't exist, let alone them being responsible for them. And then that, in turn, allows regulators to let the industry off the hook and not do their job to track and prevent damage and enforce regulations. And worst of all, individuals, communities, doctors, advocates don't have the information they need to connect the dots and really start developing solid campaigns for change. So that's why we need more testing and documentation. So I'll just talk quickly that to help bridge this gap, last year, starting to the end of 2011, Earthworks teamed up with Wilma Subra and with Calvin and Shale Test to conduct a project in Pennsylvania, which resulted in the report Gas Patch Roulette. And that research involved collecting over 100 health impact surveys or health symptom surveys from residents across the state. We covered a wide geographical area. And we conducted over 30 air and water tests as well. And the findings are all in that report, but our real goal was to try to see if there were patterns in the impacts across the state in different areas, and to compare the symptoms we were finding with the chemicals that we detected in air and water, and discern distances and whether closer proximity to impoundment pits, compressor stations, and well sites were linked to higher levels of symptoms. So I'll just mention a couple of key findings. The health symptoms reported by participants closely matched at a rate of about 68%. The scientifically established effects of exposure to the chemicals that we detected at their households. So there was this match between the symptoms and what we know are the effects of exposure for those particular people that we did air and water testing for. And an example of that is that we found benzene in a lot of households where residents reported dizziness, which is a key symptom from benzene exposure. And we found tetrachloroethylene at several houses where residents reported skin rashes, which is a key symptom related to that chemical. The other major finding was that distance does matter, and that members of households located less than 1,500 feet to these gas facilities have higher rates of several symptoms than those living further away. We were pretty relieved when we did a statistical regression that worked out that way, because that helps us in the world. And an example of that is 27% of participants reported throat irritation at distances larger than 1,500 feet. That percentage went up to 63% at less than 1,500 feet. Another example is 30% reported headaches at the longer distance. That doubled to 60% at the shorter distance. So this is just, it took quite some time and a lot of work on all our parts to do this project, but we're very aware that it's just scratching the surface of what's going on, and we look forward to working. I look forward to working with all of you, getting to know more about what's going on in other parts of the country too, even as we continue this work in Pennsylvania. And to talk about her work and helping communities, I really have the honor and pleasure to turn this over to Wilma now.